Senator Bucco.
Thank you, Chairman. First, let me commend your leadership for first bringing a resolution to the Senate that every single one of our colleagues signed on to and passed unanimously in our House. And let me make one thing clear. This is not a Democrat issue. This is not a Republican issue. This is a human issue. And the fact that we are sitting here almost 2 years after the start of this pandemic and we are still in a crisis mode is unacceptable. I have to tell you that, Commissioner, it is unacceptable. And you understand our frustrations from both sides of the aisle. But more importantly, you need to hear the frustrations of the people that are not being served. Those are the real victims here. Before I came down today, I asked my staff to put together a list of the claims that are still pending in my office. Well, let me tell you, I'm going to read some of the numbers off to you. 290 days pending, 286 days pending, 202 days pending, 203 days pending, 173 days pending, 174 days pending, 167 days pending, and the list goes on. That is unacceptable. Unacceptable, and it's unacceptable when 63% or more of our residents are living paycheck to paycheck. And when that paycheck stops, to have to sit for 290 days without a response is ridiculous. And when we shifted to the new system, when my staff submits a claim, there's nobody for us to talk to. You know, these are your own words. Unemployment is confusing, right? You use those words in your introductory comments. But yet, we submit a claim that's out there for 290 days, and there's nobody that we can talk to? Nobody that we can talk to? Let alone that the claimant can talk to. That's unacceptable. And your comments on, you know, more and more people are going to use the computer system and the system is going to be used and that's how it's going to work. I'm going to tell you what that reminds me of. It reminds me of the comments I got from the Motor Vehicle Commission before they reopened. Oh, the legislature gave us all these opportunities for people to do these things online. So when we reopen, we don't really need a plan. Nobody's going to show up. Well, let me tell you, you saw the debacle that happened when that day occurred. And I'm going to tell you, just like my colleagues on the other side of the aisle told you, that you're going to see the same thing when these one-stop centers open. You are going to witness the same thing. And what distresses me here today is your comment that you'll wait to see the response to that before you come up with a plan to address it. I got to tell you, Commissioner, you said.
I said to address expanding services.
But what is that? That's exactly what I just said. You know, when the pandemic hit and we need people to be tested first, right? You couldn't get a test, and we needed people to be tested. We opened the mega site. Then when it became time to give them the vaccine, we opened the mega site. And you know what? You're right. Eventually, those sites dwindled down after the people worked their way through the process. And we ended up shutting them down for the most part. And they went back to this normal system. Why won't you consider that today? Can you tell me why?
I'm not saying I'm not considering it, but again, in-person services is the most inefficient way to serve customers. I know it doesn't sound great. That is the data. And the folks who call in your offices, it's about 3% of the claimants in your district. 3%. and I need to focus on the 100%.
But you're already servicing 100%. If even 1% can't get service, that's 1% too much. I don't know if you recognize this, but we're in the service industry.
I do recognize that.
Okay. And you know what happens to people in the service industry that don't provide service to their customers? In the real world, they either business shuts down or they lose their job. And it's been 2 years since we've gotten any service. I mean, it's just unacceptable.
Senator,
I have a couple of questions.
Real quick.
Sure.
Your district has received $731,937,624 to 39,000 unique claimants. I can't let it go by that you're saying that's no service.
Listen,
it's almost $1 billion.
I'm happy that you processed those claims. Because let me tell you, if you didn't, my office would have been overrun. But it's not those claims that I'm worried about. It's the 290 days, the 286 days. And you're sitting here telling me that you're turning these claims over. You're not getting turned over.
I mean, do you agree that some claims aren't eligible?
Well, let me ask you a question. When we submit a claim through the CMS process, do you know what happens?
Absolutely.
Okay, walk me through it.
That claim gets entered in the CMS, but we have agents who assign it based on what the issue is. We have like a triage team. If it's something as simple as a password reset or they need identity verification, there's different.
And then what do they do?
And then the ones that have that simple process, they might be sent a link to reset their password. They'll be sent another link for their ID verification. And if somebody that needs adjudication, they go to that unit, just like the ER nurse, trauma nurse.
And what if it's somebody that doesn't have the wherewithal to get that process, to go through that?
Then they get assigned to a
complicated and confusing process.
Yeah. Then they get assigned to an actual UI agent.
And what happens then?
They're on a queue, and those UI agents have them in a queue, and they come up and they sometimes reach out to them. Sometimes they just unpen them.
Right?
It depends. Sometimes it could just be, like, for example, weekly certification. Can I answer?
Go ahead.
So if it's like the weekly certification answer, someone answer one of those questions adversely. If it's something as simple as like, oh, they did something wrong, they might need to call them real quick. Hey, were you working? What was the amount? I'll put it in there. Boom, you're cleared to go.
When you call a claimant, what does it say on their phone when the call comes in?
Unavailable. Senator, there has been so much fraud.
Let me ask you, let me ask you the next question. It says unavailable, right?
Correct.
Okay. Does your agent leave a message and say, this is so-and-so from the Department of Labor, you can call me back at this number, and I'll help resolve your claim?
It says we'll call you back. We'll call you back. Senator, if we had a phone number that was identifiable on the caller ID, millions of claimants in New Jersey would be getting scammed by folks who can fake the caller ID.
I'm not saying that you have a phone number to return, but put something so it doesn't say unavailable. It says Department of Labor.
Right, and then the scammers will do that and call every claimant in New Jersey and get the information. We've had enough problems.
Let me tell you, there's got to be a better way, and that's why I'm telling you that these one-stop centers are going to be overrun. And they're going to be overrun because if you're in the shower or you're in the middle of surgery or you're doing something else and you can't answer your phone, it could be weeks till you circle back with that person. So, listen, I'm very hands-on on this stuff, and I've been involved in it throughout the entire process. And I'm telling you, it's not working. And every one of my colleagues here is telling you it's not working. You got to do something different. You have to do something different. And to me, to finger point to the federal government as the problem
that's one of the problems.
Is not, let me tell you, that's unacceptable too.
Okay.
Because if you know where the choke points are, and we've been going through this for 2 years, if you know where the federal government has established those choke points for you, you need to have a workaround. And it can't take 2 years to get a workaround. There's more than one way to accomplish a task if one way is blocked. And just like I said to you before, if these one-stop centers get overrun, right now you should have a plan in place so that tomorrow you push the button and we go to plan B. And we don't have that. Do you have a plan B?
Yes, Senator.
What is the plan B?
I'm not going to discuss it here.
Well, I don't know who you're discussing it with, but I would sure like the Plan B to be sent to the chairman through the chair so that we can all see Plan B. Would you do that?
We'll see. Plan A is going to be fine.
That's an unacceptable answer. Chairman, I apologize, but that answer is unacceptable. That answer is unacceptable. Okay.
We'll be back to it, Commissioner. You think about the question. I'll double back to you before you leave.
Thank you, Chairman.
If I understood your testimony correctly, you said there were 12 one-stop centers that are now currently open?
All one-stop centers are currently open.
And do you have a list of where they are?
Absolutely.
Do you have it with you?
I think I do. Stand by. Go ahead. Yep, I got it. Want me to read the list?
Yeah, please.
All the one-stops that are open?
Yeah, you said there's only 12, right?
There's 24 total one-stops? Look at that list.
12. So,
Or do you want the 12 with UI services?
yeah, 12 with the UI. And then those UI services at those 12, when did they start processing?
When did they start?
When did they start processing UI claims, the 12?
I don't understand what your question is. I mean,
When could people walk in from the street to those one-stop centers with a UI problem? In other words, they're jammed up in the system.
When did they, you said?
Yeah, when did they start doing that?
I think that, in perpetuity.
So those one-stop centers never closed?
Oh, I'm sorry, the UI services? No.
Yeah.
I'm sorry, someone come off the street in the one-stop centers for workforce services since last July or whatever it was when we started hybrid. UI services are starting again on March 28th.
Okay. Why are we waiting until March 28th?
There's a lot of logistics involved in getting folks back to their office. Their computers haven't been there, their security, making sure they have the right equipment, logging onto the systems. It is not an easy process. And working with our county partners, our other state partners who are there.
I would suggest that you try to move that date up. So there's, and I'll let you read the list of 12 in a minute, but there's 12. How many total one-stop centers are there in the state?
I believe it's 24.
And only 12 are going to process UI claims out of the 24?
Senator, your own press release asked us to return to pre-pandemic in-person services, and that's what we're doing.
You didn't answer your question. Maybe I'm not understanding you. Are you eventually going to be to all 24 centers processing the UI problem claims?
That is not in the plans now.
Why?
Because there wasn't UI services there before. Based on population, based on need.
Okay, listen, but you do know that just listening to me, and I'm sure my numbers are the same as my colleagues' numbers and all legislators in the state. If you have these folks with those number of days in the queue, why wouldn't we open the other ones to at least take the burden off? Maybe you wouldn't need a mega center. You'd have 12 additional centers.
Again, first of all, the folks that are waiting who have a complicated claim like that, they are the ones that need help from a specialist, not from somebody who's going to be in the UI services in person. They probably have an adjudication issue, issues with their employer, waiting for wages from somewhere.
Okay. You had suggested removing the weekly certification for UI claimants.
Correct.
If this occurred, how would the state verify that people are actually looking for work?
We'd ask them to do that affirmatively to us. The work search requirements are able to be waived. That is a state issue. That is something we do have flexibility on, one of the few things. So we could ask them each week to just push a button, or not even that they would push a button if their eligibility status changed. Senator, the unemployment system now is based on the premise that someone's trying to defraud the system. I respect workers. and the penalties would be the same whether or not they're doing weekly certification with us every week and falling into that trap. If they could affirmatively tell us if their circumstances have changed, and if they're lying on that, they would lie on the weekly certification also. There's no difference. We get the wage records from employers. We have all the data that we need to see whether or not they're eligible based on what we have. And if they control the data, if it's something they attest to, we don't need to hear about it every week.
Okay. This is something I don't think you testified to. How many cases remain pending in front of your department's appeal tribunal?
Right now, it's 11,800.
And how quick are they being processed?
Well,
it's 11,000, another 5.
What about how quickly they get turned around? I have to check back for you, Senator. I'll get you that information.
And how long?
That is a metric we report to the U.S. DOL.
Well, I would like you to provide that through the chair, along with the average queue time in the appeal process, if you would.
Yep.
According to NewJersey.com, almost 800,000 claims have been referred to ID.me, with less than 250,000 of these claims verifying their identity successfully. That's according to NewJersey.com. Is that percentage of claimants not being able to confirm their ID online in line with what had been seen prior to the use of that program?
Well, nothing's been seen prior to compare to what we're dealing with the past 2 years.
How you used to operate.
Right. Well, so let me be clear. I mean, the identity theft that's happened since COVID is unbelievable and through the roof across the country. And U.S. DOL itself recommends having a vendor comes up to it's called IAL2 standards under NIST. And ID.me is the only vendor that provides that.
And how much money are we paying for that program? Do you know?
I do not have with me that.
And was that contract bid? Did we issue a bid for that?
And it was under emergency procurement, but I believe there was also a bid as well. Yes. I was definitely in the middle of, definitely under emergency processes, yes.
I understand. All right, if you could get that information to the chair, I would appreciate that information as well.
And just real quick, so I don't want to interrupt, but ID.me does have in-person verification services, and they've invited 650 people who said I'm not able to complete my verification online or over the phone. 650. 85 of them showed up. 13%.
Okay. Shift to something a little different now. On Tuesday, the governor delivered his budget message and published his budget in brief. In there, it was noted that $15 million in federal funds for unemployment processing, modernization, and improvements. I believe you previously asked for $200 million.
That is not true. I was asked, what can a system cost? I think my first budget hearing by someone Berticelli, if I remember correctly, back in 2018, I said some states can pay up to $200 million, like our neighbors across the river.
And have you done an analysis of what it would take to update our systems? Because it seems to me with the amount of federal stimulus money that the state has, the amount of excess revenue that has been collected, that if there was ever a time to use taxpayers' money wisely, it would be to upgrade the system. I mean, look, we all heard that you couldn't find anybody to program COBOL in order to get this done. I mean, I don't want to date myself, but that was introduced when I was in college, for crying out loud. I mean, so we obviously have an antiquated system, and $15 million in IT funding seems to me to be a drop in the bucket. And have you asked for more?
Let me be clear. You made a good comment about there's never been a better time to use taxpayers' money. I think there's never been a better time to do the right thing with taxpayers' money, which is to not make the same mistakes that we've made in the past and that every other state has made in the past, including just two of the examples I brought up earlier. No state with a modernized system is faring any better than us. And what we're doing now with our USDOL partnership is an iterative process, building pieces along that path and figuring out what works as we go along, and doing contracts and RFPs along that way. We issued an RFP earlier this week for an agile design process contractor to work with us and the U.S. Department of Labor on this process. Any real expert that isn't from a vendor will tell you the best way to contract IT is to do it in small pieces, and that's what we're doing.
Do you have a plan for that spending going forward?
Well, part of the process, part of an iterative process, is to go piece by piece. And the first piece we're doing right now, as I mentioned in my remarks, is launching new language for our front-end system on the questionnaires. By the end of the year, hopefully, we're going to have a whole new system for our claims agents, we call it the RIC, to work on claims for. And each part, and the part that was so important in the ARP last year was that USDOL and U.S. Digital Service are working on a modular design system, so that every state can take a different piece of it here or a piece of it there, rather than every state, like has been the case in every UI modernization system in perpetuity, has been to spend tens if not hundreds of millions of dollars on a humongous system, get that system, and then realize it doesn't work well for customers. So we are building on an iterative design process. We have all the resources we need, and there's no doubt, maybe next budget year we'll be coming back for more. We learned from this year, but we're very proud to have the partners of the USDOL and USDS, quite frankly, doing work alongside of us, paying for a lot of the design and programming. We're very fortunate for that. That's why I'm very excited to talk about that part of what we're doing today.
If you would, I would like to, through the chair, receive a copy of whatever process you intend to follow in building out this new system incrementally, if that's what you're saying is required.
Yep. And
I'll take your word for that, because I'm not a computer person, but I do know that something needs to be changed before this system just absolutely crashes, and then we're here for another issue. So if you could provide, look, nothing happens in government without a plan, so if you could provide that plan to the chair, I'd like to see it, because I don't want to be going down this road ever again for our residents.
Me neither.
Okay. Just real briefly, Mr. Chairman, on misclassification. We've heard some comments from the chair on misclassification. It seems that we've given you all the tools you need in terms of laws and penalties and enforcement mechanisms to root out, some of the folks that are using this misclassification system to their advantage and against their workers. Why have we not seen more in enforcement? Do you need more resources? Do you need additional assistance from the Attorney General's office in terms of prosecuting these claims? Do you need investigators to help you investigate these claims? We're talking about choke points today. Where's the choke point?
Senator, first of all, thank you so much for your support of these efforts. And you are right. Everything you talked about asking for is happening right now. There's never been a time where our departments worked so closely together with other agencies, particularly the Attorney General's office, their new affirmative litigation unit, which is working hand in hand about not being so reactive but being proactive on this front, on the criminal and civil side, working closely with Treasury. One of the bills that's passed, what we call Misclass 1.0, I think it was 19 or early 20, right before the pandemic hit, in early 20, was to let Treasury share data with us. So we now have the ability to use Treasury data, tax filings, and our enforcement procedures, and research, by the way. And we're one of the few states that has that ability, which has really helped us target the large bad actors in this space. And our misclassification efforts have really gone through the roof the past couple of years. And taking it out of just the unemployment tax side, by the way, and doing also more on the wage and hour side. Because for a very long time, misclass was something that was only about whether or not the employers paid their taxes. But on the other side of it, whereas employees who are not getting the rights of minimum wage, overtime, earned sick leave, family leave, everything I talked about before. Now, we have an ability for workers to come forward and not just assert that they are being misclassified, but to get something out of it. Not just those protections back, but 5% back of their wages. Because when you're misclassified as an independent contractor, you're paying your own payroll tax, and you shouldn't be. You're an employee. So we've been very aggressive on that front, and just like I said, just the past few months, almost $500,000 in restitution back to workers. employers. So it's not just about protecting the trust fund, which is a large part of it, not just making sure employers don't have an unfair playing field or advantage over their competitors. It's also about those workers who are being harmed as well. And we're doing everything we can. We're hiring up nonstop in wage hour as well. Like I said, I think we're almost double the investigators we were when I came into office. That's going to continue to happen. And we're, again, I would use an old term, I think we're going gangbusters in misclassification. And other states are taking notice. And we like to lead by example also.
I can tell you that from my perspective, and I know from my colleagues' perspective, this is an area that we think the prosecution of those violations needs to be addressed, and if you need additional resources, I would hope that you would pass that information through the chair, who has done a great job in bringing that forward. Let me end by saying this. I respect the position that you're in, and I may have been a little hard today.
That's fine.
But you have to understand that we're all frustrated. You know, I had one legislative aide that gave me her resignation letter over UI cases, and she was in tears. And I had to, you know, sit down with her and show her all the beautiful emails that the office received and remind her of the great work that she was doing. But it's been tough on our offices.
No doubt.
And, you know, I implore you to start thinking of a plan to address these choke points. Prepare the plan now so that if these one-stop centers open and they're overrun like we saw at motor vehicles, prepare the plan now. And let's address this issue. Let's remove these long-standing claims, and then you can get back to working on making the system more efficient. But for now, we've got to get the money into these folks' pockets that are struggling and have been out there for 200, 300, 400 days. It's just completely unacceptable. So I ask you to concentrate on that, please.
Thank you, Senator. And I can't say again enough how much I appreciate your staff's time, your time. They're hearing the same things that we're hearing every day, and it is heartbreaking. It is totally heartbreaking.